Hi, I'm Carl Rush with the Project on Community Health Worker Policy and Practice at the University of Texas Institute for Health Policy. I am choosing to focus on the word policy in my remarks to you here for the next few minutes because there's a great deal of interest in community health workers. As you may know, there are policies that are being adopted at the federal and state level about things like Medicaid reimbursement for community health worker services. And there's a growing recognition that community health workers can play a vital role as a member of a patient care team rather than being limited to part of a separate department or outreach program in an organization. The healthcare professions have come to recognize the value that community health workers contribute to a fuller understanding of not only the individual patient's life and how it affects their health and their ability to follow the directions or recommendations of providers, but also how the community is changing. The community health worker can serve as a sentinel of emerging health issues in the community, can help to inform the healthcare system of needed changes in the way they do business, to improve practices, to make the system more responsive to the needs of the community. And I would point to one specific example of this. The medical profession has come to recognize increasingly the importance of social determinants of health. And you are going to be speaking about social determinants of health with community health workers as part of their preparation. But I think it's also true that the medical profession is coming to recognize the unique and valuable role that community health workers can play in identifying the most important factors in a patient's life, the most important social determinants of that patient's health, and help the patient or the community as a whole to address some of those important determinants. This is becoming increasingly clear in the literature that physicians recognize how little they can do about these things, at the same time recognizing how much influence they have over their patients' health. We are seeing more and more organizations incorporate community health workers as members of patient-centered care teams. In some examples, the community health worker may even lead those teams because the clinicians recognize that the community health worker is in a unique position to understand the complete picture of the life of that patient. We feel that both that you should be following the policy changes that affect you in your state, in your community, within your organization, within the organizations where the community health workers you are training will be working, and also at the federal level. There have been some important moves to expand the role of community health workers in, for example, providing preventive services under Medicaid.